The future of experience in healthcare is most likely a lot less focused on hospital care, because that's typically where the focus has been on primarily the inpatient experience. The future is really across the entire continuum of care, a lot of it in the outpatient arena, because a lot of care is migrating from inpatient to outpatient as well. It will be shaped by changing consumer expectations. That it's just a natural evolution. Consumers are expecting similar experience in healthcare like they have in every other part of their being, in retail, in banking, with airlines, etc. And that will require also the integration of technology. And so that's one of the big trends, I believe, that will shape healthcare in the future, and with big implications on the experience. When we talk about patient expectations, I think we've got to start about what they are. And we've done some research around that with intensive focus groups with patients, and to us it boils down to 5 things, and that starts with that patients want us to be their partner in their care. They don't want us to dictate their care. They want us to deliver a personalized experience, and so there's personalized communication, it's personalized treatment based on their likes and dislikes and who they are as an individual. They want us to set expectations and follow through on those expectations. There's always a gap in that, or a perceived gap from patients. They want us to help them with the next step in the journey. They always feel well taken care of in the actual clinical setting, in the actual clinical encounter, but as soon as they step out of that, that's when things sort of fall apart. That's what patients need help with, and they expect the healthcare provider to help them through that journey. And then the 5th one is access, but that's not just access to appointments, having the right appointment at the right time with the right provider. It is also easy access to information, easy access to people when they need it. That's often they feel that there's a wall there. So those are the expectations that we have to live up to, and make sure that we meet those expectations and hopefully exceed those. And in a lot of those things, technology can play a big role in it. I believe when we do this right, it actually elevates the human experience, so it doesn't really replace that human touch. It takes the work away from the patient, but also from the provider. Hopefully it makes life easier for them, so that we can invest more time in the care itself, which that's been something that has eroded over time. The role technology plays is twofold. One is to support the provider, make life easier for them, and the same on the patient side. So direct to consumer tools to allow patients to do things that they don't need to depend on somebody else. So if I can manage a lot of things through functioning tools myself, then I don't have to call an office or do certain things that are just a nuisance in healthcare. And obviously there's technologies also that can help with remote monitoring and or allowing people to manage their care at home and not even having to see a provider. But on the provider side, I think there's great benefits. One of the great advances, I think, is the ambient listening tools that are out there. And we just signed a big contract with a company called The Bridge, where we have this ambient listening tool available for all physicians in our organization. That's thousands of them. It automatically transcribes the encounter that we have, the interaction, into the clinical notes and organizes it really well for them. And so far, all the providers that I speak to, they're very happy with it, and it takes some of the stress out of that encounters, and it also cuts down on what we call pajama time, because often what physicians in particular do is they see patients all day long in the clinic, they get home, they have dinner, and then they go back on the computer, and then they spend time until midnight just to finish the notes and to finish all the follow-ups and respond to messages. And that's another thing, automatic message responses that are monitored, or that it's not just a free-for-all, but that respond to messages that are appropriate to respond to, or even triage them so that it's not always the provider that needs to answer that and use their precious time to do that. It can be a nurse, it can be some of the admin staff doing that. So all these technologies will help to take the burden off and to hopefully give time back. Not just hopefully give time, it will give time back, but hopefully we can invest that time back into the human interactions. Healthcare is a human-to-human business, and that's why I believe technology will not replace the human. It will replace functions. But it will ultimately just make it easier and remove some of the friction that's there and the effort that people have to put into it. There's certainly a challenge in healthcare where innovation or progress moves at the speed of trust, because ultimately it's a trust business. So you have to make sure that the providers are comfortable with those tools, and that doesn't come overnight. That really takes using them, experiencing them. Same on the patient side. There is some hesitancy from patients in surveys that are being done in terms of trusting tools like that. Some cases, it could be up to 50% when we talk about direct patient care. That takes some time to make sure that gets implemented the right way. The other one I would say is investments. Healthcare is under a lot of financial pressure right now, which would make the case for obviously innovation and for technology investments, but in general with funding cuts and less revenue coming in, patient experience, unfortunately, is often one to go to cut back on. That's what me and my colleagues see in the industry, and it's short-sighted. And because you still have the people element, as we discussed. We have to invest in people, we have to train people, and then support them with technology, and that's always was a big investment also that organizations have to make. So another challenge I would say is that society has changed over the last 5 years. People are less patient. There's just a different sense of getting along and being civil with each other, and that has implications on healthcare and especially on burnout of employees and providers, and it's a challenging environment for them.